The coronavirus is a terrible infection. It's killed people, it's caused a lot of distress. It will in the future kill people and cause a lot of distress. There's no doubt about that. And we all have to take the usual precautions to make sure that we don't catch it and don't pass it on. Putting your hand in front of your mouth when you're coughing seems a pretty ordinary, basic thing to do. But the panic and the hysteria are wildly overblown. There really isn't any need to stop all non-urgent operations, and there's no need to close shops and cafes and put people out of work, which is what's going to happen. The economies all around the world are going to be in a terrible state. Loads of people are going to lose their jobs, and when people lose their jobs, then the death rate goes up. There's a well-known correlation between unemployment and death rates. I'm not going to offer you wild conspiracy theory. I'm going to explain why I think governments are exaggerating and what the hidden agendas are, because there are hidden agendas behind all this. First, some bold facts. I know it's not fashionable to put facts on the internet, but here goes. The World Health Organization says, and you can check all this, everything that I'm going to tell you, you can check quite easily. The World Health Organization says that the number of deaths globally per year from the ordinary common or garden flu, that's the one that doesn't have the PR people, the ordinary common or garden flu, total number of deaths globally between 250,000 and 600,000. The World Health Organization says also that the ordinary common or garden flu is easier to catch than the coronavirus. The US Center for Disease Control and Prevention says that the number of people who contract the flu can be anything up to 45 million a year. As I said, it's easy to check all this. Now, so far this year, the total number of people who have died from the coronavirus is just north of 8,000. Now, that's terribly sad, but that is a lot less than the number of people who would in a normal year have died from the flu. The coronavirus is believed to have started in January. It might have been November, December. Nobody really seems to know, but it has been around for a few months now. And in a bad month, the flu, or in a bad couple of months, certainly the flu, the ordinary old-fashioned flu, would have killed around 100,000 people, possibly more. The coronavirus has so far, I repeat, today, killed just over 8,000 people. And that is terrible, and I'm not belittling it, but 8,000 is a lot less than 100,000. And the odd thing is that the figures for flu in the UK seem to have disappeared. It doesn't seem to be possible. Nobody's saying how many people have got or have died from the ordinary flu. The forecast is that 80% of people will get the coronavirus, and that around the world tens of millions will need to be hospitalised, and the deaths in the UK have been forecast to be around 500,000, or at least up to 500,000. There are various forecasts been around in the papers. As an aside, I rather suspect NHS administrators wish they hadn't reduced the number of hospital beds in the UK over the last 30 years by half. There are now only about 140,000 beds in British hospitals. All those people, if all those people really did get the coronavirus, they're going to be sleeping 3 a bed. The media has been hysterical. I saw one headline which said people will die. Well, I'm sorry, but people will die from falling off horses, people die falling down the stairs, people die in all sorts of ways, and it's always sad. But really, is there any need to exaggerate quite so wildly and get so excited and hysterical about it? But this is something that happens from time to time. You may remember AIDS. In the 80s and 90s, we were told that AIDS was going to affect every single one of us. The whole of the nation was going to be affected by AIDS. That didn't quite happen. We were also told that SARS was going to kill a vast number of people, that mad cow disease, Ebola, it goes on, the various different types of flu. Now, what's been happening during the hysteria is really rather strange, and it's rather telling. One of the things that the government has done in the UK in particular, is to say that all people over 70 have to stay in their homes. At first they said it was going to be for 4 months, and now it's been reduced to 3 months, but they're talking about it might be a year and it might be 18 months. and people have been told that they shouldn't leave their homes and that food should be left on the doorstep so that they don't have any contact with people at all. Now, I find this rather odd because there are 90-year-olds who run marathons. I don't actually run marathons, but I can totter along quite speedily, thank you very much. And after I pointed out on my website that the real risk with the coronavirus was not someone's age, but how healthy they were. In other words, most of the people who had died from the coronavirus were people who had underlying chest diseases. After I pointed that out, then the government changed its mind and said, oh, well, they better stay in as well. So they're going to have to stay in, but still the over 70s have to stay in. And of course, there's self-isolating for anyone who's had a cold or a cough or a sniffle. And the self-isolating period was 7 days, and then it became 14 days, which is also a puzzle because there is some evidence that the bug can be transmitted for 28 days. And the last time I looked, 28 was bigger than 14. The next thing we need to look at, and the really important thing here, is the death rate. Now, the death rate for the coronavirus seems to be very high, or at least we're told it's very high. But let's look at how these figures work. If 100 people have an infection, 100 people have the coronavirus and 4 of them die, then the death rate is obviously 4%. If 1,000 people have the coronavirus and 4 of them die, then the death rate is 0.4%, and so on and so on. But they're only testing for the coronavirus in hospitals, and they're only testing seriously ill patients. So it's a pretty obvious fact that there are an enormous number of people in the community who have the coronavirus, but who haven't been tested and haven't been shown to have the coronavirus. Now that means that the death rate is nowhere near as bad as they're saying it is, because if 10,000, 20,000 people have the coronavirus and the death rate is what it is, then the percent, and the number of people dying is what it is, then the death rate, the percentage of dying, is much smaller. And it's just, I think, another way to try to exaggerate the importance of this infection. Now, why would they be doing it? What's going on? I think it's all part of a demonization, marginalization, dehumanization of the elderly. I think that's one of the hidden agendas. That's why they want to lock up over 70-year-olds. And don't forget that doctors all around the world have said they won't be able to treat over 70s if they get the coronavirus. And in fact, it has been said by a number of doctors that they won't be able to treat over 70s whatever they have wrong with them, because they'll be so busy treating these hundreds of thousands, millions of people who've got the coronavirus. Now, you have to remember that old people around the world are costing governments a lot of money. They're costing trillions in care and pensions. And in order to deal with this, governments have been, for a long time, trying to reduce the amount of care they provide. For example, in the UK, old people who have macular degeneration will very often find it impossible to get treatment that would quite cheaply prevent them going blind. And yet there seems to be plenty of money for cosmetic surgery and gender reassignment and so on. The United Nations has made it very easy for governments all around the world, by saying that anyone over 70 who dies doesn't have to be counted in the illness death statistics for that country. So that means that when old people die, the country's health services don't seem to be doing badly, because the people over 70 don't count. And don't forget that the UK invented the Liverpool Care Pathway, the most misnamed thing I can ever think I've ever heard of, in which old people in hospital in particular, were deprived of food and water so that they would die, and the hospital bed could then be used for someone else. All this, I think, is part of the hidden agenda. Governments are trying to demonize and marginalize, as I said, the elderly. They're saying we won't be able to treat the elderly. And once this little crisis is over, what I believe is a manufactured crisis, once it's over, then the elderly will still be deprived of medical care because governments will have got the process rolling. Also, I suspect that when the vaccine becomes available, and this is my second theory for the hidden agenda, when the vaccine becomes available, it will not be voluntary, it will be compulsory, because governments everywhere have been trying to introduce compulsory vaccination for some time, and once the coronavirus vaccine is compulsory, then all vaccines will be compulsory. So watch out for that. There are all sorts of other possibilities. Is it all part of leading us to a cashless society, because we keep being told that banknotes carry the virus? Is it part of a plan to be able to crash the world economy without blaming the banks, because the banks have been creating more mayhem very quietly since 2008? One thing for certain is that taxes are going to go up when all this is over. Governments are going to put taxes up a lot, and they're not going to be bringing them down. Anyway, in a few weeks' time, have a look at the death rate from the coronavirus. It's currently, I think, just over 8,000 globally. And remember those WHO, World Health Organization figures? If there haven't been at least 50 to 100,000 deaths from the coronavirus by the middle of April, then you'll know that the governments and the media around the world have been exaggerating, and you'll know why. You won't see me debating this issue on television, particularly the BBC, because I've been banned from the media for quite some years for the terrible crime of telling uncomfortable truths. But you can keep up to date with what I believe is going on by looking at my website, www.vernoncoleman.com, which has free access for everyone, and there's no adverts. Thanks for watching.